Good day and welcome to today's presentation. Please note this webinar is being recorded. All participants are in a listen-only mode. If you would like to ask a question, please enter it into the Q&A panel located at the bottom of your screen. It is now my pleasure to turn the call over to Lisa Sullivan. Please go ahead.
Thank you. Good afternoon, everyone. My name is Lisa Sullivan, and I am looking forward to a wonderful event today. Welcome to the CMS CDC Fundamentals of COVID-19 Prevention for Nursing Home Management, a series of national nursing home training sessions that are geared specifically to the pandemic. This training will allow nursing home personnel to receive certificates for attending. We have referred to this series as the National CMS CDC Nursing Home COVID Training Curriculum in the past. Thank you for taking the time to be with us here today, and a special thanks as well to our CDC colleagues for partnering with us on this important training series. Just a few reminders before we get started. The slides and resources can be found on the QIO program website, and the recording from today's event will also be posted there within a week, so be on the lookout. During the open discussion period, please keep in mind that we will get to as many questions and comments as time permits. But if there are any unanswered, we will address those post-event, and they will be included on the QIO program website once finalized. Next slide, please. It is now my pleasure to introduce our speakers today, Gayle Atherton and Nanci Newberry of TMF. Gayle is a registered nurse with over 30 years dedicated to finding ways to provide excellence of care and caring for residents in long-term care. She maintains certifications as a professional in healthcare quality and dementia practitioner. Gayle has been a healthcare quality improvement specialist with TMF Health Quality Institute for 2.5 years. Nanci is also a registered nurse and has worked in healthcare over 30 years. She has a master's degree in health education and is certified in patient safety and healthcare quality. Nanci has been with TMF Health Quality Institute for the past 5 years and is currently the Patient and Family Engagement Coordinator. She enjoys helping patients to learn to become more activated, to do what they can do to live their best possible physically, mentally, and spiritually. Gayle, the virtual floor is yours.
Thank you, and welcome to everyone, and I appreciate the time you're taking to attend today's seminar program. If we could go to the next slide, please. Okay, so today's objectives, we will be looking to learn any updated guidance and policies regarding the transparency during the public health emergency. We'll be learning more about best practices to implement a comprehensive and actionable communication plan. And then we're going to have a glean into the insight from a family member of a nursing home resident and conclude with learning strategies to provide compassionate care and communication during the COVID-19 pandemic. Next, please. So up front, we're going to do the regulatory stuff, and federal guidance requires transparency regarding the COVID data collection and reporting to residents, to representatives, and families. And we'll be focusing on that component of the regulation, in addition to having accountabilities to the local, state, and federal level. So we know since June that we have been reporting, and by we, I mean the nursing home industry, the facilities. I've been in the industry so long, I feel like I'm part of it. We've been reporting our data to the Center for Disease Control and Prevention through the National Healthcare Safety Network, known as NHSN. And it was initiated with the intent of having it available for facilities, stakeholders, and public. And we'll talk a little bit later about the fact that that information is available. And there is a link here on this slide that will take you to the full guidelines so that you can review them in their entirety. Next, please. So when you go to that link, you will see survey letters. I call them survey and certification letters because I go that far back, but they are currently called Quality, Safety, and Oversight, or QSO letters. This happens to be a snippet of the May 6th letter that did introduce the requirements for notification to us. This letter includes more than just what is evidenced in that little gray box, but so you may want to go and look, because it also talks about the new federal tags that can be cited to facilities for failure to report and failure to follow up with notifications. Next, please. So, what are we required to report? What are the requirements for notifying residents and families? If you have a single confirmed test, you have an obligation to notify the residents, staff, and families within by 5 p.m. the following day. So today's Thursday, you get a positive today. By 5 p.m. tomorrow, Friday, a notification to your residents, et cetera, is required. But in addition to that, there is a requirement to notify related to symptom clusters. And what does that mean? That means 3 or more residents or staff with new onset of respiratory symptoms consistent with COVID-19 infections within a 72-hour period. Could be 1 resident, 2 staff, all residents. So in addition to the confirmed COVID positives for residents and staff, we really need to be acutely aware of those assessments and identifying respiratory systems. And we all know that we're heading into the flu and pneumonia season. So heightened awareness, whether it really is COVID-19 versus other potential infections, that's part of the whole investigation piece. But remember that the 3 or more symptom clusters is reportable also. Next, please. So, in addition to reporting after you have a newly identified positive test, whether it's staff or residents, or you have your clusters, you are obligated to report a minimum of weekly on the status of COVID in your facility. And whether you're reporting because you had a new positive or you're reporting on your weekly, the obligation includes reporting your cumulative numbers to the facilities. Now, if you have multiple opportunities or needs, I guess, to report during the course of a week, each time you report, you're also, the new test, you're obligated to report the cumulative numbers. So you may be doing a reporting frequently throughout the course of the week, depending on your situation in your facility. The bottom of the slide does give you a direct link to the QSO letter 20-29-NH for nursing home, and that again gives you the full detail of this information. Next, please. So when you are notifying the residents, the responsible parties, and the families, you do not provide personally identifiable information. So you're not identifying staff member, resident, et cetera. But you also need to, in addition to the fact that there is a reportable item and you're reporting your cumulative, you are being asked to include information on mitigating actions that you have implemented to prevent, or reduce the risk of transmission, including whether or not your normal operations of the facility are going to be altered. So this takes a lot of planning. This is more than just we have a new positive and we have 19 cases, just picking numbers out of the air. But what are we doing? What are we changing? What are we looking to implement to further protect everyone within the environment and reduce the risk of further transmission? So again, by 5 p.m. the next calendar day for the new item and a minimum of weekly, should you be fortunate enough to not have any new positive COVID tests appear during the course of a week, and no clusters identified. And just for repetitive and safety, there's that darn link again to the same QSO letter. I want to make it as easy for you to get to that letter when you find that it's time to do that. Next slide, please. Now, we know that there are infection control focused surveys happening, and we know that after a positive testing, the survey team or surveyors may come to your building. And one of the things related to these notification guidelines that they will be doing is asking and interviewing the residents and their representatives to determine, are you doing timely notifications? Are you doing complete notifications? And that is in addition to anything that they can find out on NHSN or anything that you're reporting to your state and local. It's a follow-up of compliance with the regulations. Now, you're required to make a reasonable effort to notify residents and representatives and obtain the information so that the families can obtain the information that you're required to provide. And what does that mean? What is reasonable effort? Next slide, please. Facilities need to know the population within your community, know the communication modalities that are reasonable and appropriate for your families and residents. And there might be group email lists for people who are very, I want everything by email and you'll get me, and maybe you can compose an email that goes out. But perhaps you have me as a family member, and you send me an email. Well, I don't look at my personal emails for like maybe 2 weeks at a time. So is that a reasonable effort to reach me? Something up for discussion. I could be very easily notified through text or telephone call. So the example is not just to say you need to call me, but to say we need to be aware that one stop doesn't fit all needs. And of course, with your team and the families that you've been working with, you would know what best. It could be mailings, it could be recorded telephone messages, it could be a number of different things. But think about how many different modalities and who. Maybe I am the only person who needs that phone call, but whoever is placing those calls, and everybody has a day off sometime, I hope, whoever is placing those calls really needs to have some identifier of what's the right modality. Again, you don't need to call every family. You don't need to talk to everyone personally, but what is reasonable? And that's something that within your community you want to consider, look at, and determine. So next, please. Relationship between transparency, accountability, and quality in nursing home care. We know that accountability and quality of nursing home care is very, very critical to ensure that the folks that we are caring for and their families are receiving the best information and the most timely information. The transparency comes along with the reporting, reporting accurately, reporting timely, reporting completely into the NHSN database. There's quite a number of questions, and I do admit that there is, but hopefully most of them do not take an additional burden of time. But we now have the true transparency available out on Nursing Home Compare. On Nursing Home Compare, there is there are two areas that you can gather COVID data information from. One is the link to the NHSN data reports, which is quite an expensive file, but it's available there for everyone to see. And the other is a link to the infection control focus surveys that happened during a minimum of the time frame of March through May, and you would be able to see what types of deficiencies were being found, et cetera. So there is now the accountability with the reporting, the transparency, and overall a goal of quality of care in the nursing home. That is not to say it's not a challenge, because there is a lot of things that have been a moving target, so to speak, as we learn more and more about COVID-19. Next slide, please. So some challenges emerging from the constant stream of information. I am certain that most of you, if not all of you on the call, are very aware of the ongoing media coverage and how sometimes the message that is sent may not be the actual core data. So we need to just be aware of that. We need to be discerning in the media coverage that we're listening to, and also be aware of the potential for becoming part of the media coverage. You're also receiving, in addition to something from the CDC and CMS, the federal level of the country, information from your local counties and your states. That all needs to kind of be embraced and incorporated and followed, so that you are providing for your community, based on your community statistics, the most up-to-date and current practices for mitigating the risk of COVID-19. And then family and community updates are always on an evolving situation at the nursing home, and I'm sure that is something that I could probably learn a great deal from each of you about what has been happening. But we are learning, and we're moving forward. Next slide, please. So, comprehensive communication plan. We're talking about communication, and we're talking about notifications of families. For you, whether you're a COVID-only facility, whether you have no COVID in your facility, wherever you're at, the importance of having the communication and the open dialogue with your staff, your local and state government, your residents and families, the long-term care ombudsman, and what a value that the ombudsman can bring in some of the challenges that we're meeting in the extension of this COVID period. The media, I will say no further from that. And then other local healthcare entities, constantly in touch, et cetera. So next slide, please. There are two resources that I want to wind up my portion of this training with. And one is the Coronavirus Disease 2019 Preparedness Checklist for nursing homes and other long-term care settings. It does have a facility communications section, but it is far more extensive than that. And if you are still struggling to have some sort of system in place, that could be a great resource. The other, for reference for state-specific guidance, is the Toolkit on State Actions to Mitigate COVID-19 Prevalence in Nursing Homes. The Preparedness Checklist link is there at the bottom of the slide. If you copy the toolkit title into a web browser, it will take you to the toolkit, and you're looking for version 6, July 2020. As states develop different resources, it gets populated into this toolkit, and it is an amazing resource that everything from strike teams to assistance with staffing. So next slide, please. I am now going to turn the program over to my colleague, Nanci Newberry, who is going to share communication strategies with you. Nanci?
Thank you, Gayle. Hello, everyone. This is Nanci, and I want to just start by thanking you for your dedication and commitment to your residents and their families during such challenging times. And I'm going to be sharing some strategies and links to lots of resources that I hope you might find helpful in your quest to providing compassionate care and communication during the COVID-19 pandemic. So some communication strategies just in general. I like to say stay as positive as possible and offer options as it's whenever possible and safe. There's a lot of scripting and conversation guides that you'll see kind of weaved in throughout this, the rest of this talk. And I probably, just for sake of time, won't have time to go into each one in detail. But the Optimistic Care site is one that I just found out recently about, and it's got some good information on optimizing patient transfers and handovers and serious illness care program. They've got a lot of videos and a toolkit that you might find helpful. The American Healthcare Association and National Center for Assisted Living has a template for notifying residents and their representatives and family members, but in that link, there's also some additional resources you might find helpful. One for tips for keeping patients engaged, keeping people connected, and compassionate care amidst the COVID-19 crisis. And all of these links and resources are going to be available on the QIO program.org website. And so we're posting them in chat, and they'll also be available on that website along with the recording and the slides from today. So just kind of sit back and listen, and you're going to get, hopefully lots of good stuff. Next slide. We're going to, so as far as resident-centered care during COVID, it's obviously very important, as Gayle said, to keep the residents informed. I've heard recently about some, care settings that are using virtual rounding, which I thought was kind of cool. I think of town hall meetings, and one idea that I don't know if anybody's thought of or that you're using is using your in-house television system to broadcast maybe your town hall meetings. And it's important to know what matters most to your residents so you can customize your care and communication. You may have heard it's not what's the matter with you, but what matters to you that's really important. And I want to lead you to the Age-Friendly Health Systems platform, the IHI website. If you haven't heard of the 4 M's, what matters most is the first one, and then there's medication, mentation, and mobility. So a lot going on with that age-friendly concept, so please check it out. And then My Story is one program that you can use. The link is here, and you download the form and the guide on how to use it. But if you haven't seen it, it's a really cool template that you can fill in with, and it's cute. It's got a tree and some clouds around it, and it's got like about 25 different blanks that get filled in. And the clouds, are different things, like my favorite sports team, my favorite color, favorite food. And it's just a way to really quickly help your staff establish that relationship with the resident, and can also be used in any care setting as a way to document things that are, where the resident can document what's important to them. And I think, and in your in the resource guide, you're gonna have links to more of those types of opportunities to get to know your residents. Next slide. Communication tips. So PPE can be very depersonalizing. It's hard to, you can't see the person's face, you can't see their mouth. It's hard to read emotions and expressions. We do a lot of nonverbal communication that's that PPE causes like that a barrier for us. One idea is attaching a photo or like a headshot to your gown, and you can Google or the PPE portrait project, and there's a lot of good information. I was looking at one yesterday that Stanford has on how to make and apply the PPE portraits if you're interested in learning more. But those has, if you walk in with the full PPE, the hazmat suit, it can be really scary and intimidating. Some tips for communicating while you're wearing a mask. Don't shout. Take your time speaking. It's going to be a little muffled. Use the teach back method. Check in with the resident after you say something and make sure they, to make sure they heard what you said. And be mindful of distractions and distracting noises. And I thought this was a good one. Learn sign language, and don't forget to use interpreters for residents who are unable to read lips because they won't be able to with the mask. I was thinking my church is actually posting a sign language class coming up, and I thought, well, I've had kind of trouble learning a foreign language. I took 4 years of Spanish and can't really speak, very well. But I thought maybe I'll take a sign language. I almost think that could be fun. Next slide. So now we want to take a little break, and I'd like for us to hear a story from Lisa regarding her family's experience with a loved one recently in a nursing home, and then we'll come back to discuss some considerations for more family-centered care strategies, and then go into some more resources. Lisa, can you join us?
Yeah. Hi, thanks, Nancy. This is Lisa Sullivan again. And I appreciate being given time to share with you a personal story. I actually had an extended family member pass away in a nursing home on May 4th of this year. Aunt Tony was 88 years old. She didn't have any children of her own. And one of my cousins I'm very close to was considered her nearest relative. She had end-stage congestive heart failure, to the point where she needed fluid drained every week, and she really wasn't able to care for herself and ended up going into a nursing home last summer. Now, the nursing home they picked is listed as a 4-star nursing home on Nursing Home Compare, but was really selected because of the close proximity to my cousin. When they visited, they told me that the facility was indeed old, but it was obvious to them that the staff took really good care of the residents, and that made them, really, really happy. So she went into the nursing home last summer. So fast forward it to end of March this year. My cousin got a phone call in the middle of the night, and the nursing home staff informed her that Aunt Tony's roommate was sick and needed to be urgently quarantined. And they whisked Aunt Tony out of the room and put her into another room. So over the next few days, we realized that what was happening, we were all very scared. Aunt Tony was scared. We didn't know at the time, does that mean she was going to die? It really left us all very unsettled. But amazingly, Aunt Tony was negative for COVID-19. A few weeks later, mid-April, my cousin got another call in the middle of the night from the nursing home staff. And guess what? Aunt Tony's roommate was very ill, had to be quarantined, and they were urgently whisking her out of the room to go into another room again. And again, Aunt Tony was scared, and we were all really frightened because we just didn't know what that meant. But Aunt Tony was pretty tough, and COVID-19 was afraid of her, so she never did test positive for COVID-19. But as the pandemic progressed, she did relay some of her experiences with us. So we couldn't visit her because obviously no visitors were allowed. As it progressed, all the nursing home staff wore what Aunt Tony told us, which was hazmat suits, like something you'd see on a space alien show. And they weren't the people she was used to seeing. She was very used to her caregivers, but she said these were strangers. She wasn't even sure who was coming into her room at every time. That the COVID testing, she said, it was painful to her. and she hated it. And she was being tested frequently. She said that the staff, it was obvious to her the staff were scared, and they were busy, and they were tired, and they were coming in and out of the room, and they really didn't talk to her like they used to, and they would kind of drop off her tray, and I mean, she had congestive heart failure. It was a little hard for her to get everything together and sitting up, but they would give her the tray, and out they would go, and they were busy, and she understood that. She couldn't have any visitors. She wasn't allowed to leave her room. Toni wasn't much of a reader, but she loved watching TV. But unfortunately, she was hard of hearing as well. And other residents complained because her TV was on too loud. So at the end, her last few weeks of life, she also could not watch TV. So she couldn't read, she couldn't watch TV, she couldn't talk to anyone except for when my cousin made her regular calls with her. Since my cousin couldn't visit, she didn't really realize that Toni's condition was deteriorating as fast as it was. And she wasn't told that the time was near for Toni. So my cousin didn't have the opportunity to call a priest to do what her religion wanted for Toni. And then when my aunt died, my cousin got a call in the middle of the night, the last one, and to let her know that Toni had passed away. And the rest of the message was, you need to arrange for someone to come get her body within 24 hours because we don't have room for it here, or else we're going to have to send her somewhere else, which was so upsetting to my cousin. That was the thing that really put her over, because in her mind, that meant that they were going to take Toni's body and throw it in some unmarked grave. So she had to rush and jump through hoops within 24 hours to get her body picked up by the funeral home and have Toni's remains cremated. So Toni did not want to be cremated. That was never her wishes, but that is what we had to do. And everyone knows we did not have a funeral, and we did not obviously have a burial, and we had the most awkward grieving period that we could ever imagine or ever anticipate. So in sharing the story, I'm not trying to place blame on anyone. My aunt was very appreciative of the care that she got, but I really just wanted to share one family's experience. You know, she did not die of COVID-19. She died despite COVID-19. And I hope it was beneficial to share how it impacted just one family in America. So, Nanci, let me turn this back over to you.
Lisa, thank you so much for grounding us and letting us hear the perspective from your family's point of view about your experience. Next slide. Thank you again. Family-centered care during COVID, and I apologize, I'm going to have to start talking fast, and there's a lot of information, and I see a lot of good questions in the Q&A. If you haven't already thought about maybe virtual family town hall meetings as far as a way of keeping the family members involved in electronic newsletters, I would be interested to know how those ideas sound. And when I think of reopening and visitation considerations, I think of it as an opportunity not only to communicate with families, but also to help educate them. Next slide, please. And what I mean by that is perhaps they could have a role. They already, residents and families are already important partners in preventing the spread of infections, and clean hands count for the residents too. These are two good links from the CDC. I just kind of picked a couple of a poster and a video. They do have, you know, how to don and doff, and some posters or information that I think are good kind of plain language types of resources. I was on the CMS dialysis call yesterday. Had a patient that talked about how the staff member handed her a mask, and she could tell they had touched the inside of the mask, and she said, "Could you please hand me another one, you know, that where you only touch the ear loop," because she was, you know, hesitant to put it on. So lots of, as you all know, things that we can do to better engage the patients and families as well as our staff with infection prevention and control. Next slide, please. Family communication, we want to support those meaningful connections to minimize isolation, loneliness, separation, distancing, all side effects of this quarantining, and there's lots of good resources for you to access on mitigation strategies. Next slide. Social isolation and loneliness, I like when we say physical distancing versus social distancing, because what we really need right now is social connectivity or making those connections, which happens to be the theme for October's, the Consumer Voice has this on their site. You can learn a lot more about it. There's a lot of good resources as far as connections being essential for good health and quality of life for residents, especially after months of these visitation restrictions. There's also ideas for staying connected and communication tips you can get there. The friendship line is something that I came across recently. I've heard about it a couple of times. We're not really endorsing it. CMS is not endorsing nor TMF, but if you want to learn more about it, it's a national 24-hour support line for lonely, isolated, depressed, frail, and or suicidal seniors, and we've got the number there. Next slide, please. There's a lot in the news lately that has caught my eye. I'm not going to talk about these stories, but this slide and the next two both give you links for. I mean, this is a lady. The first one I'll just mention a lady after 114 days of being separated from her Alzheimer's. Her spouse with Alzheimer's. Took a job at a nursing home as a dishwasher in order to be able to see him every day. The hugging booth, you can read about the hugging booth that somebody came up with in the Woodlands, which is just north of Houston here in Texas. And a really cool, safe way for people to get a hug. I'll let you Google that to see more. Next slide. Robotic pets, another possibility. Next. As you know, pandemics can be stressful. If you're not going back and checking the CDC site, there's a lot of good updates and resources. Two others that I think are worthy of mentioning, the Elder Care Locator and 211, both really good programs that can help you with resources available to connect older adults and their families to services that they need. And you can either search online or you can call the phone numbers. And 211, I tell people if you need 911, if you need like a physical emergency, you call 911. If you have social or need community resource needs, call 211. Next slide. Lots of good information that is specific for your residents that may have dementia. Next slide. Important to have those serious illness conversations, and as Lisa's story kind of showed us, there's a lot of awkwardness in the conversations and in the events all surrounding these COVID experiences that residents and their families are having. And there's a lot of good resources, and again, more scripting and conversation guides that you can access here. Next, please. This is a tool. I'm just not going to have a lot of time to talk about it, but if you haven't seen it, it's called Go to the Hospital or Stay Here, a decision guide. It's not just for advanced care planning, but it does a really nice job of talking about the difference between comfort and palliative care versus hospice. And there's an algorithm that can kind of help people make a decision whether they do want to go to the hospital or stay treated in the nursing home. Next, please. I want to be sure that you know about these CMS Learning Opportunities. There's a lot of calls weekly. We've got them kind of categorized on our website at tmfnetworks.org, and you're welcome to check there to get registered and learn the dates and times. Next, please. The IHI has, they've been for 15 weeks now having a huddle call every morning. Actually, it's noon Eastern time for 20 minutes. And this is they're on week 15 right now. And I think they're going to start going to 2 days a week. Last week was all about dementia. The week before, disparities. I'm just giving you a little kind of background if you're not already connected. All of it is archived and you can access the recordings and the slides and a ton of good resources. And then this Nursing Home 411, same thing. I think I saw a family council meeting notice template and lots of other resources, podcasts, webinars, etc. Next slide. This is our website. You're welcome to come in and look around. You can click on that the coronavirus link there, the widget in the middle. Next, please. And it'll take you to our resources and updates. And at the bottom of that little menu on the left-hand side, you can access webinars and teleconferences that we're aware of that you can register for, and lots of good resources in for different care settings, including nursing homes. Next, please. If you don't know who your QIN-QIO is, this is where you would go to find out. And there's a little blue box at the top left. Locate your QIO, and you just enter what state you're in, and it'll tell you who to contact. Next. Key takeaways: be timely with notifications and reporting. Make sure you have a good communication plan. I think of having that in place and implement it, being ready to implement and evaluate during the pandemic, but also during emergencies like natural disasters. Hurricane season is supposed to be like double what it normally is, and there's wildfires and earthquakes and other things that you might find the need to have your communication plan ready to go. Stay current with updates, revisit those sites like Gayle said, and implement both best practice and innovative interventions for effective communication and care. I think that's it. We have one more slide. Contact us if you have any information, but let's go ahead. I'm going to turn it back over to Lisa for some Q&A time. Thank you all.
Thanks so much. Gayle and Nanci, we really appreciate your powerful presentation and for all the great resources that you have provided. At this time, we would like to conduct an open discussion. Today we have Namali Stone and Kara Jacobs-Slivka from the CDC, along with Bonnie Reed and Sheila Hans from CMS's Division of Nursing Homes here, in addition to Gayle and Nanci to answer your questions. So if you have any questions, please go to the bottom of your screen, click on the Q&A button to enter them. Please remember we'll get to all the comments and questions that we have time to address during the live event, but we'll attend to those unanswered post-event. I also would like to take this opportunity to ask that you please complete the post-event assessment. We value your feedback on how we can improve these in future trainings. The link will be added to the chat box for your submissions and will automatically pop up at the very end of our time together. Let me go ahead and kick things off with the first question. Is this training that we are listening to right now tied to the Provider Relief Fund? And the answer to that question is no. We will be providing information in the next week or so that will detail how to access that separate training module tied to the Provider Relief Funds. We will be sending this information via email to everyone who has registered for today's training. We'll also send it out through our QIO program and other professional organizations. We anticipate that this notification will go out in the next week or so. Angel, you want to take over for the next question?
Yes. So our first question is for our CDC colleagues. Will the CDC be creating a more specific resources on donning, doffing PPE when not in conventional use? The current tools have a disclaimer that facilities will need to adjust their procedures to accommodate reuse and extended use. A new video would be helpful for staff.
Hey, this is Namali. Go ahead, Kara. I just want to make sure you were on the line.
Yeah, sorry. Feel free to comment as well. This is Kara. I was just going to respond and say that we definitely recognize that there are it can be challenging to be able to understand and demonstrate to others some of the different strategies that have been recommended based on where you're at in terms of your PPE supply. And so we definitely hear that and have been trying to talk and brainstorm on how we can help support educating around those things. I think the most important thing overall in terms of PPE use and training is to understand the appropriate way to use that when you have full supplies, the full amount or supplies, so that everyone is able to use the PPE the way it's intended to be used. And so while we do have some information on the website, not videos, but written information about other types of use, that is definitely something that we have been talking about, and I think we'll continue to consider how we can best educate on those, on the other, like crisis capacity, for example, strategies. Feel free to add additional, Namali, if you had additional comments.
Oh, no, I agree. And I do think sometimes the approach has to be tailored, as Kara's mentioning. So it is a little bit challenging to meet the different needs of centers that are at varying levels of supply. But we do appreciate the feedback, and we'll think about other ways to help provide guidance, that can help with this implementation issue. We're really hoping that at some point we have restoration of our supplies and we can move away from this crisis strategy completely. Thanks.
Thank you very much. And let me go ahead and say our next question, which is from Mindy Tarver. Can you talk about best practice for sanitizing items that families drop off? And that might be for CDC.
Sorry, Lisa, I missed part of that. Can you?
Oh, so sorry. Yes, could you talk about best practice for sanitizing items that families drop off to their loved ones?
Got it. Thanks. So it's an interesting question about what is the potential role of objects. Might be clothing, might be linens, might be a care package with like a box with gifts. So what is the potential risk of those types of items serving as a vector for COVID introduction? We really feel like that kind of surface and those kinds of objects are probably very low risk. And, given what we know about the person-to-person part of COVID spread, that to us is the place to focus our resources. Some centers have opted to just have those kinds of packages placed, kind of in a safe area for a day or two. I mean, I don't even know that is really necessary, because I just don't think that that is a significant source of spread. And we're really thinking a lot more about the direct person-to-person transmission as more of the driver of introduction of COVID. Thanks.
Thank you, Dr. Stone. So the next question I will pose to our CMS colleagues from the Division of Nursing Homes. And this may or may not be something that we can answer on this call today. But someone says that they saw a press release recently stating that states with greater than 5% positivity rate will have to start testing all residents and staff weekly. Is this a CMS mandate that will be coming out soon? And so Sheila or Bonnie, if you're still on, just let us know if that's something that we could address today or not.
Hello.
Sure.
Thank you.
Hi. Hi. Oh, go ahead. Go ahead, Sheila. Okay, great. Sorry. I tried to respond and I was on mute. This is Bonnie Reed from CMS, Division of Nursing Homes, and we really don't have anything to respond to that list today.
All right, great. Thanks, Bonnie.
Mm-hmm. Thank you.
All right, let me go ahead and ask our next question, which is, what do you do when residents refuse to wear face masks and stay in their rooms? And I'm not sure if Gayle or Nanci might be able to provide any insight on that.
That's a good question. This is Nanci. Gayle, do you have any ideas? Or anyone else? I'm actually not sure if there's any specific guidance on that. So someone please chime in if you know.
And I apologize, I was on mute. This is Gayle, and my immediate reaction is, I guess it depends on the status of the facility, the COVID, where they are, et cetera. Staying in the room may be the correct option. So I don't really have a regulatory answer to that. And if others coming into the room are wearing their masks, again, it's really not I'm trying to think it through and not doing a very good job of it. So that's an excellent question, and I would kind of like to see if there's any information out there. I just don't know it off the top of my head.
All right, thank you so much. The next question is in regards to notifications for families. Is doing a letter on our website okay?
If you're asking if that's okay as the isolated action, it might be if your population is in tune to accessing your website for information and has the resources and the knowledge. But if you're asking, could it be one of different venues for notification? I would imagine absolutely yes. And there are out in the on the web some sample notification letters that might be an appropriate one to post on a facility website. So I'm not sure it could be the standalone modality.
And this is Kara, just adding that, I mean, the reason for doing these things is to communicate with, family members, even possibly with residents, healthcare personnel, and wanting to, in trying to communicate as best as possible, it may mean that there are multiple different methods that are used. And so, it sounds like that could be a way to communicate, but I would agree that you want to make sure that if you are putting information on your website, for example, that people know to look there. And so they are still notified in some way that there will be information posted on the website, so they can go there and know to check and don't feel like they are without any kind of communication if they're not aware of that.
Thank you so much. Let me go ahead and tee up the next question, and this is very pertinent to this topic. The governor of our state says that compassionate visits are allowed. What constitutes a compassionate visit? Is it for hospice, or is it for any resident who needs to see their family because their dementia has worsened or their overall health is declining?
Hi, this is Bonnie Reed with CMS Division of Nursing Homes, and we have put out, there is some frequently asked questions out there. I was just quickly trying to look up the QSO memo number where that can be found to better explain compassionate visits. I can tell you that the answer is not strictly just for hospice or end-of-life purposes. There are so many periods or so many instances that it's really difficult to lock every one of them down and list those as possible, scenarios. So I think that the compassionate visits, compassionate care visits, is a discussion between the visitors and the facility. And I can try to find that QSO memo that was released, and maybe I can circle back with the group here, and it can be posted with other responses if that works with you guys. Lisa.
Yes, thank you. All right. So, Lisa, I think we have time for one more question or so. Is that right?
I think so.
Okay. So the next question is, how long should nursing homes be providing the weekly updates following the last positive diagnosis?
Hi, and this is Bonnie Reed again from CMS, the Division of Nursing Homes. And in preparation for this, I would direct folks to QSO 2029 nursing home. I would direct folks to that memo that went out, and you should find answers to your questions there. If not, we'll certainly can look further. That's QSO 20-29-NH. The date on that is May 6th, 2020.
And hey, this is Namali from CDC. I would just also share that several centers do continue to share weekly updates that even though it's not about cases, it's still, they maintain an ongoing touch point for families to hear about, how everyone's doing or the sort of status. Sometimes there are facilities that are at a place where they can start to do a little bit of introducing small group activities, for example, and things like that. So they keep that process in place even though it's not about COVID per se, and it maybe depending on the way you're communicating, that might be easier or harder to do, but it has been a way to maintain a continuity of interaction with the residents' families. Thanks.
This is Gayle. If I might take just a minute. QSO 2028 NH does include a list of frequently asked questions, and question number 4 relates to compassionate care situations and examples. And I would encourage folks to go out to QSO 2028 nursing home and look through the FAQs, because they do provide a few examples of what might be considered compassionate care.
Thank you, Gayle, and thanks, Dr. Stone. Next slide, please. In an effort to provide participants more options to view these important nursing home trainings at their convenience, we are moving them to a pre-recorded sessions, and they will no longer be delivered live, but will be available on the website listed on the screen, QIOprogram.org. On August 20th, the first of these pre-recorded sessions on cohorting strategies will be available on QIO Program website at 4 p.m. Eastern Time. We will be holding bi-weekly, hour-long live Q&A sessions dedicated entirely to interaction with participants sharing comments and taking questions. Questions will be answered by CMS and CDC. The live Q&A sessions will begin on August 27th from 4 to 5 p.m. Eastern Time. These open Q&A sessions will require registration, and we will share the registration link now via the chat. We are hopeful that this will allow for more on-demand type of learning for our busy attendees, while being able to offer a live interaction session to address comments and questions. Next slide, please. Thank you again for your participation in today's call. We hope you found some value in the topics discussed. Please take a moment to complete our survey from today's event. Thanks so much.
That concludes today's presentation. Thank you and have a great day.